puncture-wise and see what we've got. Treat it. If I've got a chiropractic issues, I treat it, come back and check it with thermography to see if I've got it. If I've got it, it'll change in a matter of just a few minutes with thermography camera. And it's non-invasive. It does not hurt the animal. I just stand back. It's just nothing more than taking a picture of the animal. And when we do this, we're looking for areas of hot areas. And I'll kind of go over this pretty quick with you because we want to work on some horses yet here. So I'm not going to go into all this. Basically, we was talking just a little bit earlier about the different types of diagnostic imaging and stuff that can be done. Anatomic imaging, radiology, ultrasound, computed tomography, MRIs, where physiological imaging is more scintigraphy and thermography. And these are different types of methods that can be used for diagnosing certain problems on. And some of the uses that we use, it's a diagnostic tool, enhance the clinical examination, assessment of training stress, regulatory use. And we're looking for areas of heat. And you have to tell me what you can see as far as colors and stuff because I understand.
No, I can do this.
Okay. So basically what we're looking for is, and you see we've got, this is the horse is coughing, you can see we've got areas where it's very hot. You're perpetually generated by the body. Heat is perpetually generated by the body. Dissipates through the skin. You got different types of heat. You got radiation heat, convection heat, conduction heat, and evaporation heat. You're also looking for inflammation. You're looking for heat will cause inflammation. Pain will cause inflammation. Swelling will cause inflammation. Rubor or tenseness to the tissue will cause inflammation, and loss of function will cause inflammation in an area. The skin temperature. Generally, skin is 5 degrees centigrade cooler than the body core temperature. Skin derives its heat from the local circulation, from the tissue metabolism. Then we'll look at thermal patterns as dictated by circulatory patterning. If you look at this area here on this foot, you got a white area right in the middle here. If you look at the vasculogram on the left-hand side, you'll see right in that same area, we've got an issue going on right here. So you look at the local vascularity, surface contour. You look for thermal patterns. On the midline, you're looking for the back. You look at the back and see, is it uniform across the back? Excuse me. Is it uniform across the back? Is it uniform across the chest? Is it uniform across the rump? The heat in the extremities follows the vasculature. So you got the cephalic veins on the inside of the front legs and stuff that you'll see. They'll be a little more red. The saphenous veins on the outside of the rear legs, on the inside of the rear legs, and the greater metatarsal arteries are on the outside of the rear legs. And they will all show up a lot more hot than any other areas. Other thermal patterns, the dorsal view or the front view of the foot of the leg will also be cooler. Tendons will be relatively cool. This is the back of the front leg, and that blue area is basically how these tendons and stuff run. So they basically tend to be a lot cooler. The heat between the metacarpal and metatarsal, 3 bones, and the flexor tendons, that's basically the blood vessels that are running there. Coronary band and laminar corium are warmer. So right around the coronary band is usually a bit warmer than other areas. Between the bulbs of the heel is warmer. That's where the blood supply is. So you tend to see a little more warmth there. So you use it in lameness examinations. Evaluate the gait. Do palpation. You want to feel these animals. And that's the thing I think is a big problem in veterinary medicine. We don't touch these animals enough. I think we need to touch them. Manipulative tests. That's another way to do it. Perform systemic thermographic examination. I can do a full body scan on a horse in probably about 10 minutes, where I can check everything from head to toe, between his front legs, his rear legs, between his, on his chest, and between his, that's mine, between his back legs. I think that's probably the office. Thermography is a diagnostic tool. Inflammation may be detected thermographically as either a hot spot or a cold spot. And you're also looking for major differences in temperature. So a hot spot associated with localized inflammation, generally seen in the skin directly over the injury. This would be a bowed tendon right here. This is a cold spot. Diseased tissue that may have reduced blood supply due to swelling. It may be due to thrombosis of the vessels. This is the frostbitten nose on a horse. Infarction of the blood vessels means you've got clotting of blood there. It's not moving blood to that area, so it'll tend to be cooler. Scar tissue. Scar tissues will show up as a very blue area. And some of these scars and stuff, I've actually looked at this thermographically, excuse me, thermographically, and come back in and injected these scars, and they will change color instantly. And the blood flow will start flowing to those areas.
Dr. Andrews, is white hotter than red?
White is hotter than red, yes. Yeah, and there's a scale on the camera and stuff, and we'll show you with some of the pictures. They may show a little bit better. So the whiter it is, the hotter it is, and it'll go down to blue. To lavender will be the coldest color. Sympathetic tone, in other words, the nerve function to that area is going to change. Used to evaluate the back and hind most commonly, and the upper limb lameness. A lot of times it's very difficult to diagnose upper limb lameness without using thermography. Evaluation of poor performance or pre-purchase is the second most common use. I'll do this on show cattle. I'll go down and do thermographic images on show cattle and find where these animals have got issues already going on with them, back problems or things like that. And also on these barrel racing horses and jumpers, hunter jumpers, and even some of these draft horses that are in the draft shows. Some of these draft horses have some major issues going on with them because of their size. Evaluation of forelimb lameness. So if I'm looking at, excuse me, and you'll see there's a scale on the right-hand side of this pictures here, which basically gives you the degrees and temperature and stuff, what the differences is. And it goes from blue all the way up to white. So the more color, you want the color to be more even. If you look at this thermograph as a physiological tool, you want to evaluate the whole horse, not just one particular area. If I'm going out to just evaluate a horse that's got a shoulder problem, I may just look at the shoulder. But if I'm looking at a horse that basically they don't know what's going on, I want to know what's going on everywhere on that horse, not just one particular spot. So it may take me a little bit longer to do it. But when I do it, then I come back and check it afterwards and see if it's changed. If it's changed, then I know I've got the problem treated. Lameness in one leg will cause changes in other limbs as well. So these animals will compensate from one leg or another. If you look at the bottom two pictures here, whoops, let me go back here. Look at the bottom two pictures. These are the flanks of the same horse on the right side and the left side. And you notice on the right side, down at the bottom here, it's more red on the right side than it is on the left side. Show you this a little bit better here. This is the left side of the horse here, and this is the other picture here. This is the right side. So this stifle area on this horse has got a problem here on this right side. Yes, also look at this shoulder here compared to this one. There's a definite difference in the color of this, the blood flow to this area. There's a lot more inflammation going on here than there is on this side. A lot more blood flow going there. So there's a definite problem going between the right side and the left side. Excuse me. Some of the frustrations you have with diagnosing lameness, you're going to have upper limb lameness, which is sometimes very difficult to diagnose. Lameness too subtle to utilize diagnostic analgesia. In other words, you may be injecting joints and things like that to try to figure out where the problem is, and it still keeps showing up lame, and they're not sure where it's at. So that's where thermographic imaging comes in. A horse is not amenable to injection. The horse does not like to have injections done to it. And believe me, that's a lot of them. So if you're looking at back pain, is it really real on a horse? This horse has got an injured withers. The one on the left is a normal horse. This horse has got an injured withers right here. Look at the difference in the color here and here. There's definitely a difference here. And because of that, this horse is basically very, very sore across the withers. So you go and put a saddle on that horse, and guarantee you he's not going to want to stand there very long. Good correlation with anatomic imaging. So when we're looking at this one right here, this horse has got a back problem. So when we look here, we take an x-ray of the back, we got condition in horses which is common we see in some of these older horses called kissing spine disease. These vertebrae are all almost fused together along this back on this horse. And you can see it right down the back here. It correlates with the x-rays very closely. It shows that this horse has definitely got a problem with his back. So, you know, I get a lot of people that say, well, the veterinarian says it's not a back problem, it's a leg problem. You'd be surprised how many horses have got back problems that are totally misdiagnosed or missed altogether because they're looking at the foot or the leg instead of looking at the full horse and watching how the horse moves and what he does.
Have you ever done chiropractic adjustment and seen any
Yes, yes, absolutely. And that's what we're going to look at and stuff to see if we've got horses that basically have just got something just mildly out of place, neck or hip or something like that, and we'll adjust them, then do thermography on them again, and you'll see the difference and stuff in the areas. Yes, absolutely. Okay, you're looking at the tuber cocci on this horse here. You notice there's a difference. There's also a difference right up here over the back, right in the sacrum. This horse has got sacroiliac desmitis. What that means is, this right in here is extremely painful. These tendons and everything and the muscles around the sacrum back in here are very, very sore. So he's compensating, showing pain across his hip here. And notice the differences down along in here. There's differences down in here along the blood flow and stuff on these areas. And that makes a big difference on how these horses will move. Then we take and do an ultrasound on that sacrum, and we see that there's an abnormal side is thinner and less than what this is on the normal side. So you can confirm this with ultrasound, you can confirm this with x-rays, you can confirm with other ways. But a lot of times the thermography doesn't lie as far as what the differences are in temperature. There's definitely a difference there in temperature. So we're looking at this horse here. Anybody see any difference right now? Look here. Look at this shoulder here. And look down in here. There's a difference here. Now, let me show you. It's called bicipital bursitis. And what that is, right on the top of the shoulder. And what that is, go back here. What that is basically you've got what's called a bursa that hits in the shoulder area here, and it lubricates that shoulder. And sometimes these horses, especially performance horses, barrel racing horses, things like that, will injure that, and they're really sore in that upper part of that shoulder. But you can't figure out why. You can take x-rays until you're blue in the face and never find it. You can do ultrasound a lot of times and give you an indication, but ultrasound is much more expensive. And if you do an ultrasound on that, there's that bursa. You got increased fluid in that bursa right here. Got a lot of inflammation going on in that bursa. So it confirms that there's definitely something going on there. Then, to enhance a clinical examination, provides information that you did not know you did not know. Okay? Clinical examination, you always palpate and manipulate to determine if the injury exists. Because you can manipulate these and move them around and see if there actually is an injury there. And they will tell you pretty quick if there is an injury there. Imagine if you could enhance your palpation sensitivity by 10 times. And that's where thermography can help us. Because we can enhance it by looking at certain areas much quicker. And what I've found by using the thermography and with the acupuncture, I can usually enhance a little bit more of what I'm doing as far as what I'm feeling. Associated splint. If there's some desmitis associated with a splint, there's a splint, there's a suspensory desmitis. So it confirms it with the thermography. Objective measurement of inflammation. Okay, there. Vasculature and blood flow to tissues. Where do we have problems? When the skin distal to the area injury approaches room temperature, disruption of the vasculature has occurred. So where do we see that difference? Right there. So what's going to happen with his leg? His leg has been bandaged, and the bandage is taken off, and the bandage was too tight, and basically has compromised the vasculature of that leg. And that horse basically had some serious issues going on with that leg for probably 3 months because of the fact is the way they had been told to bandage it was improper, and the bandage was way too tight. Vasculature, you're looking at, this is a horse that basically has got frostbite foot. Coronary band and the hoof capsule of the right foot shows the same temperature as the environment. She's very cold. Indicative of loss of blood supply. Now, if we also take a picture of that foot, yes?
Just about this bandaging. I read some research about that bandaging can harm a horse more than it can do good because you're taking away the natural way of the
movement.
Mechanism.
Right.